Uh, Gotta cover pain today. God, that's one of those ridiculously complicated, but actually ultimately kind of simple concepts in our field. Just because you're injured doesn't mean it's going to hurt. Just because you're hurt doesn't mean you have an injury. It's weird. It's counterintuitive, but I mean, we've all had those moments where you mash yourself up, you have a huge bruise later, you have no idea when you hurt yourself. You look down, there's a softball-sized purple spot on your leg, and you're like, "Holy crap! That looks like it really would have hurt," and you don't even remember. Well, it's because at the time, your brain was very likely preoccupied with something more important. Because pain's an output from our brain. It's not from your body. We don't have pain receptors. We have nociceptors. Those can indicate potential tissue damage. And they have a pretty high incidence of being interpreted as indicative of pain. But what happens is your brain receives signal from your body, from thermoreceptors and mechanical receptors, and it says, this fits within my safe paradigm. Okay, fine. This fits outside of my safe paradigm. Ouch. And that's all pain really is. It's an output. Now, are there different degrees of it, different characteristics? Certainly. Can it be life-altering? Absolutely. But ultimately, at the end of the day, the pain you're feeling is an output from your central nervous system saying something needs to change. Something you're doing is something I consider bad for you, and so something you're doing is something I think you need to stop doing or change how you're doing. And I'm going to give you a warning for that. And if you don't listen to that warning, it's most likely going to get worse. And so we now have to look at our movement variables, our ranges of motion, our rates of motion, our resistance of motion, and see what we can change to try to reduce that pain in training or moving. We have to look at what controls might be missing to perform those movements safely, like proprioceptive awareness, a good sense of balance and body positioning, or muscle energy, the idea that the muscles are acting towards threshold level of output, whereas maybe they're not, but the brain doesn't know that. And so you push hard, and you're nowhere near tissue failure, but your brain doesn't have data on that. Quite simply put, the software might not be up to date with the hardware, and that question mark in between, that's where you start to get your varying levels of pain output. And then it hurts. So, we can look at movement exploration. We can look at all kinds of different avenues. But just because you're hurting doesn't mean you're actually injured. Just because your shoulder's sore doesn't mean you have a torn rotator cuff muscle. Just because your back is sore doesn't mean you have a slipped disc. It might just be a question mark from your central nervous system that you need to address.